I'm Anya Graney-Elrod. I'm a communications coordinator with the Center for Celiac Research and Treatment at Mass General for Children. Today, I'm lucky enough to be here with my colleague, Martha Pacetti, who's a certified pediatric nurse practitioner with extensive experience in treating celiac disease and other gluten-related disorders. Welcome, Martha.
Thank you for having me.
It's nice to be here together on this sunny Tuesday. So for the first question I have for you, Martha, let's kind of roll back into the past here. And, what drew you to a career in medicine and in particular to the nurse practitioner role?
So I started doing nursing in 1980 after graduating college. And I did a variety of different specialties, including ICU, the ER, outpatient clinics. And I really wanted to be independent and have more of autonomy. And so I actually had one mentor who was the only nurse practitioner at Tufts Medical Center at the time. And I said, I really want to be like her. She has some independence. She's holistic. She's got a really nice way about presenting and meeting with patients. So I went back to graduate school at Northeastern. I graduated in 92. I had 6 people in my class, students in my class. Today, there's 40 to 60 in a class. So I feel like I was a pioneer in the nurse practitioner role because nobody knew what we were. One person actually asked me if I was going to serve food, and I was going to be service of food in the hospital. So people really didn't get what I did. And so I'd have to introduce myself and explain the role. And now I walk in a room and a patient's just like, oh, a nurse practitioner, and they feel very comfortable. So I think we really give a nice addition to the team because we look at the whole person and have more of a holistic type of practice.
Right. And then how long have you been with us at the center, Martha, at the Center for Celiac Research and Treatment?
So Dr. Persano came to Mass General in 2013 from Maryland and brought his lab with him and started and opened the Celiac Center at Mass General. So I was asked to join the team then. So I've been with the Celiac Center since 2013.
Oh. Now, you work with adult and pediatric patients, correct?
Yes.
And have you seen, in that time, have you seen changes in how we diagnose and treat celiac disease?
So I think the diagnosis has definitely changed, not in the way we diagnose, but probably the population. We used to think of it as a young child's disease, that 3 and 4-year-old had the typical bloated stomach and looked kind of failure to thrive, diarrhea, those kind of symptoms. Now we know there's actually 2 peaks of the disease that we see in this population at age 7 and age 40. So really it expands the whole lifespan of the population. So we've had patients age 70 be newly diagnosed with celiac disease. It doesn't mean that they've had celiac disease since they were 3 or 4. It's just at some point that disease got triggered and turned on, and then they got diagnosed later in life. The treatment is about the same. It's still on the gluten-free diet. And now that there's so many more foods out there that are available for patients, which has really helped patients' choices and being able to follow the diet a little bit better. And hopefully for the future, we'll have some medications that will come out, but there's a lot of research going on with that development.
Great, thank you. It feels really silly, Martha, to ask you about a busy clinic day, because I know that applies to all your clinic days. But, on those very back-to-back busy days, what brings a smile to your face? What's your favorite part of the role of nurse practitioner?
Well, I think, like I was saying, it's kind of corny to say, but we are a real team effort. And when we go into our conference room on Thursdays, we have so many people. We have our dietitian, we have Dr. Fasano, Dr. Leonard, our fellow Dr. DeFonte, our, like I said, the dietitian, Katrina. We have research coordinators. We just have a whole group of people in this one conference room. And we kind of bounce things off each other. So we learn from each other, or we might look up things or learn about new research that's going on in the celiac area. And then we also teach those medical students and residents And then we also laugh about each other's life, and we are almost like a family. So that always brings a smile, and that I really enjoy going into that clinic on Thursday because I know we're going to have some fun. So that's kind of nice. And of course, you know, having our patients satisfied and being grateful, and they've come from a long way, and we may figure out a problem that they've had or helps them with a diagnosis of celiac disease or even a gluten disorder, which people even believe in, but now we know there's that whole population that have actually not celiac disease, but do have a gluten sensitivity. So it's just nice to, when the patient leaves the visit and turns to you and says, "Oh, I'm so happy I came." It's very gratifying.
I can imagine, and well deserved, Martha, from what I hear anyway. That's it. I want to thank you for being here today, telling us more about your role, about your work, and about your kind of career path into being a nurse practitioner. And thank you for joining us here today. On our website, we have many resources for both patients, families, and providers. It's celiaccenter.org. That's celiaccenter.org. Or check out our other videos on our YouTube channel. So again, thank you to Martha, and thank you, and hope the rest of the week brings lots of smiles to your face.
Thank you.